Our presentation today is about sphenoid bone and foramina of the skull. The sphenoid bone is one of the 8 bones that make up the cranium, the superior aspect of the skull that encloses and protects the brain. Its name is derived from the Greek sphenoides, to mean wedge-shaped. Anatomical structure: the sphenoid bone is said to be butterfly-shaped. It consists of the body, paired greater wings and paired lesser wings, and 2 pterygoid plates on each side. This is the medial pterygoid, and this is the lateral pterygoid plate. This is an axial CT scan of the sphenoid bone, in which we can see the sphenoid body and the greater wing of sphenoid. This is the foramen ovale, and this is the foramen spinosa. The sphenoid is an unpaired bone. It sits anteriorly in the cranium and contributes to the middle cranial fossa, the lateral wall of the skull, and the floor and sides of both orbits. It has articulation with the 12 other bones. Unpaired bones: occipital, vomer, ethmoid, and frontal bones. Paired bones: temporal, parietal, zygomatic, and palatine bones. Let's see this image in a 3D image of the skull. This is a 3D image of the skull. We can see the sphenoid bone in articulation with the frontal bone, with the parietal bone, with the temporal and zygomatic bone on each side. Also has articulation with this bone, which is called the ethmoid bone, and the vomer and the palatine bone. To see these bones, we must hide the maxillary bone, the zygomatic bone, and this small bone, which is called the inferior concha. To see the palatine bone, which is this L-shaped bone. This is the palatine bone in connection with the sphenoid bone. And this is the vomer bone, has articulation with the sphenoid bone. The last bone that has articulation with the sphenoid bone is the occipital bone, which is evident here. This is the parietal bone. Let's hide it and see the sphenoid bone in connection with the occipital bone. The body lies at the center of the sphenoid bone and is almost completely cubical in shape. It contains the sphenoidal sinuses, which are separated by a septum, meaning that the sphenoid body is essentially hollow. The body articulates with the ethmoid bone anteriorly, and it is here that the sinuses open into the nasal cavity. The superior surface of the sphenoid body contains some important bony landmarks. The chiasmatic groove, a sulcus formed by the optic chiasma, where the optic nerves partially cross, and the sella torsica is surrounded by the anterior and posterior clinoid processes. The anterior clinoid processes arise from the sphenoidal lesser wings, while the posterior clinoid processes are the superolateral projections of the dorsum celli. They serve as attachment points for the tentorium cerebelli, a membranous sheet that divides the brain. The sella torsica is a saddle-shaped depression. It has 3 parts. The tuberculum celli forms the anterior wall of the sella torsica and the posterior aspect of the chiasmatic groove. This is the tuberculum celli. And the pituitary fossa is the deepest part of the sella torsica, where the pituitary gland is located. This is the pituitary fossa or sella torsica. And the dorsum celli forms the posterior wall of the sella torsica. This is the dorsum celli. And this is the anterior clinoid process, which is part from the lesser wing of sphenoid. And this is the posterior clinoid process, which is part from the dorsum celli.
محمد راح الصوت.
is the deep. Pituitary fossa is the deepest part of the sella turcica, where the pituitary gland is located. The dorsum silli forms the posterior wall of the sella turcica. This is the dorsum silli, and this is the anterior clinoid process. This is the posterior clinoid process, and this is the clivus, which is part from the occipital bone. This is lateral skull radiograph in which you can see clearly the sella turcica. Let's see the 3D image of the skull. This is the sphenoid bone, and this part is the sphenoid body, which is a cubical in shape. العفو وياي، الصوت موجود؟
نعم وياك محمد.
تمام. الصورة هم واضحة لو بتقطع؟
واضحة تفضل.
تمام. This is the sphenoid bone, and this is the sphenoid body, which is a cubical in shape, contain superiorly the sella turcica, bounded anteriorly by the tuberculum silli and the dorsum silli. These projections from the lesser wings called the anterior clinoid process, and these projections called the posterior clinoid process, which is part from the dorsum silli. Let's see an image of the sphenoid bone separately. This is the sphenoid body. Note there is error in labeling the sphenoid body in this program. This is the sphenoid body. The normal limit of the sphenoid body is just in that area. And the foramina and this foramina is the part from the greater wing, not the sphenoid body. So the sphenoid body is a cubical in shape that contain air cells anteriorly. These are the air cells. These are the air cells that's separated by a septum and connected to the ethmoid air cells and then to the nasal cavity. The sphenoid, as I said, the sphenoid body contains superiorly the sella turcica, and this is the dorsum silli, and this is the chiasmatic groove in the tuberculum silli. These are the anterior clinoid process, and these are the posterior clinoid process. Okay. The greater wing extends from the sphenoid body in a lateral, superior, and posterior direction. It contributes to 3 parts of the facial skeleton: floor of the middle cranial fossa, lateral wall of the skull, posterolateral wall of the orbit. There are 3 foramina present in the greater wing: foramen rotundum, foramen ovale, and foramen spinosum. Let's see this information on the 3D image of the skull. This is the greater wing of sphenoid that arises from the lateral wall of the sphenoid body, and it contributes to the floor of the middle cranial fossa and the lateral wall of the skull and the posterolateral wall of the orbit. It contains 3 foramina. This is the foramen rotundum, and this is the foramen ovale, which is oval in shape, and this is the foramen spinosum. Lesser wing arises from the anterior aspect of the sphenoid body in a superolateral direction. It separates the anterior cranial fossa from the middle cranial fossa. It also forms a lateral border of the optic canal through which the optic nerve and ophthalmic artery travels to reach the eye. Medial border of the optic canal is formed by the body of the sphenoid. There is a slit-like gap between the lesser and the greater wings of sphenoid, which is called the superior orbital fissure. Let's see the lesser wing in the 3D image of the skull. These are the lesser wing of sphenoid that arise from the superolateral aspect of the sphenoid body, and it turns superolaterally, and it separates the anterior cranial fossa from the middle cranial fossa. It forms a lateral boundary of the optic canal, and from which the anterior clinoid process arises. Okay, let's complete the presentation. The pterygoid plates descends inferiorly from the point of junction between the sphenoid body and the greater wing. It consists of two parts. Medial pterygoid plate supports the posterior opening of the nasal cavity, and lateral pterygoid plate, which is a site of origin of the medial and lateral pterygoid muscles, part from muscles of mastication. Let's see the pterygoid plates in the 3D image. These are the pterygoid plates. This is the medial pterygoid plate, and this is the lateral pterygoid plate. The medial pterygoid plate supports the posterior nasal cavity, and the lateral pterygoid plate is a site of origin of the pterygoid muscles, which is part from muscles of mastication. This is called the pterygoid process, which is the origin point for the medial pterygoid muscle. Note the most inferior part of the sphenoid bone is the medial pterygoid tip, inferior tip, which is the first part of the sphenoid bone that appear in the axial CT scan, that if we start from inferior to superior. The foramen of the skull, the first foramen is called the foramen cecum, located anterior to the cribriform plate, represent a primitive tract between the anterior cranial fossa and the nasal space. During the embryological development, this foramina contain a dural diverticulum, which extend from the anterior cranial fossa to the dermal surface of the nose, normally undergo complete involution and fills with fibrous tissue and variably ossify. Frequently found in infants, uncommonly in children, and rarely in adults, where less than 1.5% remained. Rarely transmits emissary venous connections to the nasal cavity. This is the foramen cecum, which is located anterior to the cribriform plate and crista galli. And this is a focused axial CT scan of the skull showing foramen cecum. This is the foramen cecum. Optic canal lies in the sphenoid body and run from the sulcus chiasmaticus anterior to the tuberculum silli, anterior-inferolaterally to the orbital apex, and transmits the optic nerves and ophthalmic arteries. The optic canals are wider posteriorly than anteriorly, and owing to their oblique course, a special radiographic projection, the optic foramina view is required for their visualization. العفو، الصوت والصورة واضحات يمكن؟
واضحة بابا، واضحة، كمل.
تمام. Let's see the optic foramen in this 3D image. These are the optic foramens that starts superior, that starts anterior-inferolaterally, runs anterior-inferolaterally, and it is wider posteriorly than anteriorly, and through which the optic nerve and ophthalmic artery passes. The lateral boundary is formed by the lesser wing of sphenoid, and medial boundary is formed by the sphenoid body. This is the optic foramina view or Risi position, in which you can see the foramen, the optic foramen. And this is an axial CT scan of the head in which you can see clearly the optic canal that run anterior-inferolaterally to reach the orbital apex. Superior orbital fissure is a triangular defect between the greater and lesser wings of sphenoid. It transmits the first or orbital division of the trigeminal nerves, the third, fourth, and sixth cranial nerves, superior orbital vein, a branch of middle meningeal artery. This fissure is best seen on the occipital frontal view with the 20-degree caudal angulation. This is the occipital frontal view with 20-degree caudal angulation, in which you can see clearly the superior orbital fissure. And this is sagittal CT scan of the head, in which you can see clearly the superior orbital fissure. Inferior orbital fissure located between the maxilla and the sphenoid bone and transmits the infraorbital nerve and infraorbital artery and inferior ophthalmic veins. At its posterior part, it forms an opening between the orbit and pterygopalatine fossa, and more anteriorly between the orbital cavity and the infratemporal fossa. Let's see the inferior orbital fissure in the 3D image. This is the inferior orbital fissure between the sphenoid bone and the maxillary bone. It forms a connection between the orbital cavity and the infratemporal fossa, and also between the orbital cavity and pterygopalatine fossa. To see the pterygopalatine fossa clearly, we must hide the maxillary bone and the zygomatic bone and the inferior concha to see this cavity between the L-shaped bone, which is the palatine bone, and the sphenoid bone. The sphenopalatine, this cavity is the the pterygopalatine fossa. This cavity between the palatine bone and the pterygoid process is called the pterygopalatine fossa. This is a coronal CT scan of the head in which you can see the inferior orbital fissure. This label is for the superior orbital fissure, and this is the optic canal. Foramen rotundum lies in the greater wing of sphenoid posterior to the superior orbital fissure. It runs from the middle cranial fossa to the pterygopalatine fossa and transmits the second maxillary division of the trigeminal nerve. It is seen on the occipitofrontal view with the 20-degree caudal angulation and the occipitomental views also. This is the occipitofrontal view, 20-degree, in which you can see the foramen rotundum. And this is axial CT scan of the head in which you can see the foramen rotundum. Let's see the foramen rotundum on the 3D image of the skull. Let's hide the parietal bone. This is the foramen rotundum that lies in the sphenoid greater wing, just below the superior orbital fissure. It makes a connection between the middle cranial fossa and the sphenopalatine fossa, as I mentioned previously. This is the sphenopalatine fossa. Median or pterygoid canal is located in the body of sphenoid and found inferior and medial to foramen rotundum. It connects between the foramen lacerum and the pterygopalatine fossa and contain the median nerve and artery. Let's see the median nerve and artery on the 3D image. The median canal. The median canal located inferior and medial to foramen rotundum. To see it, we must hide the occipital bone and also the temporal bone. This is the pterygoid canal or median canal that passes or connects between the foramen lacerum and the middle cranial fossa and the pterygopalatine fossa. This is the pterygopalatine fossa, and this is also the foramen rotundum, and this is the median canal. This is an axial CT scan of the head in which you can see the median canal that connects between the pterygopalatine fossa and the foramen lacerum. Foramen Ovale lies in the greater wing of sphenoid, posterolateral to the foramen rotundum. It runs from the middle cranial fossa to the infratemporal fossa and transmits the third or mandibular division of the trigeminal nerve and accessory meningeal artery. This foramen is best seen on the submental vertical projection for the base of the skull. This is the SMV view of the skull in which you can see the foramen ovale. And this is axial CT scan of the head in which you can see the foramen ovale. Foramen spinosum lies in the greater wing of sphenoid bone and posterolateral to the foramen rotundum. It transmits the middle meningeal artery and passes from the infratemporal to middle cranial fossa. It is best seen on the SMV skull projection. This is the submental vertex view of the skull in which you can see the foramen spinosum. And this is an axial CT scan of the head in which you can see clearly the foramen spinosum. Let's see the foramen ovale and spinosum on the 3D image of the skull. This is the foramen ovale, and this is the foramen spinosum that connect between the middle cranial fossa and the infratemporal fossa. Foramen lacerum ragged bony canal posteromedial to the foramen ovale at the apex of the petrous bone. The internal carotid artery passes through its posterior wall, having emerged from the carotid canal, which runs in the petrous bone before turning upward to run in the carotid sulcus. This foramen can be seen in the SMV skull projection. This is the foramen lacerum. And this is an axial CT scan of the head in which you can see clearly the foramen lacerum. Let's see the foramen lacerum in the 3D image of the skull and the carotid canal. Let's refresh the view. أخ أستاذ الصوت واضح بالصورة؟
نعم واضح محمد.
تمام. Let's have the parietal bones. And see, this is the ragged bony canal between the sphenoid bone and the temporal bone, which is the foramen lacerum. This is the carotid canal that passes. This is the carotid canal that passes in the petrous part of the temporal bone. From this side inferiorly, then ascends in the petrous part of the temporal bone, then ascends anteriorly in the carotid sulcus. This is the carotid sulcus in the sphenoid body. This is the internal auditory canal, in which passes the facial nerve and vestibulocochlear nerve. And note this small foramina is called the stylomastoid foramen, in which the facial nerve passes and exits the skull in a foramina between the styloid process and the mastoid process, which is called the stylomastoid or facial foramina. This is the jugular foramen, which lie posterior to the carotid canal. This is the carotid canal, and this is the jugular foramen, as you see. And this large foramen is called foramen magnum. And this is the hypoglossal canal, which is the canal for passage of the hypoglossal nerve, the 12th cranial nerve that exits the skull anterior to the occipital condyle. This is the hypoglossal canal. Internal auditory meatus and canal run from the posterior cranial fossa through the posterior wall of the petrous bone into the inner ear and transmits the facial cranial nerve and the vestibulocochlear cranial nerve and also the internal auditory artery. Best seen on the centroid AB view of the skull when they are projected over the orbits. This is the centroid AB view of the skull that shows the internal auditory canal. And this is an axial CT scan of the head in which you can see clearly the internal auditory canal. The jugular foramen is an irregular opening situated at the posterior end of the junction of the occipital and petrous bones. It runs downward and medially from the posterior cranial fossa and transmits the internal jugular vein, inferior petrosal sinus, ascending occipital and pharyngeal arterial branches, the 9th and 10th and 11th cranial nerves. Special radiographic projections اللي هو under-tilted submental vertical projection are required for its visualization because of its course. This is an axial CT scan of the head in which you can see the jugular foramen posterior to the carotid canal. Hypoglossal canal is anterior to foramen magnum and medial to jugular fossa and transmits the hypoglossal cranial nerve. It requires special projection for radiographic visualization, which is called reversed transverse projection. This is an axial CT scan of the head in which you can see clearly the hypoglossal canal. Foramen magnum runs from the posterior cranial fossa to the spinal canal. It transmits the medulla oblongata, vertebral and spinal arteries and veins, and the spinal root of the 11th or accessory cranial nerve. This is best seen on the submental vertex projection. This is a submental vertex projection of the skull in which you can see clearly foramen magnum, and this is a 3D CT of the skull in which you can see clearly the foramen magnum. Before we take the quiz, I will talk about this nice case from Radiopedia, which is a normal CT scan of the head in a bone window. As you see, there are many labels, about 78 labels. So I will talk about only the labels related to my presentation on sphenoid bone and foramina of the skull. We start from the bottom of the image to the superior part. The first part, as I said previously, the first part of the sphenoid bone that appear from inferior is the inferior tip of the medial pterygoid plates. This is the inferior tip of medial pterygoid plate. As we ascend, we can see the beginning of the sphenoid body. This is the sphenoid body, and this is the greater wing of sphenoid. This is the pterygoid or median canal, and this is the foramen ovale. This is the foramen magnum. This is the clivus, which is part from the occipital bone that is connected to the sphenoid body. This is the inferior orbital fissure. And this is the foramen rotundum. This is the hypoglossal canal. This is the spheno-occipital synchondrosis. This is also foramen ovale. And this is foramen lacerum. And this is foramen spinosum. This is the carotid canal. And this is the jugular foramen. This small foramina is called the stylomastoid foramina, which is the exit part or exit point of the facial nerve from the skull. This is the carotid canal that run anteriorly and in the carotid sulcus in the sphenoid body. This is the supraorbital foramen, and this is the crista galli. This is the sphenoid air cells. This is the external auditory canal, and from this side we can see the beginning of the stilla turcica and pituitary fossa. This is the pituitary fossa, pituitary gland, and this is the carotid groove or sulcus. This is the superior orbital fissure, and this is the optic canal. This is the internal auditory canal, and this is the anterior clinoid process that arises from the superior part, which is the lesser wing of sphenoid. This is the tuberculum cilli, and this is the internal auditory canals, as I mentioned before, and this is the dorsum cilli from which we can see the posterior clinoid process. Now we reach the quiz.
قبل ما نروح على الكويز حتى نسأل نور محمد جواد.
نعم أستاذ.
رقم 15.
Foramen Ovale.
Foramen Ovale. دكتورة مريم.
نعم دكتور.
رقم 16 ورا الفورامين اوفالي.
فورامين سباينوزوم.
فورامين سباينوزوم. اوكي هاي شتيت. نروح عبد الكريم ناهل.
نعم دكتور.
رقم 17. انت راديوثيرابي.
راديوثيرابي.
خلينا ناخذ جماعتنا وانتم بعدين لانه
شاء الله.
اول محاضره.
إن شاء الله.
دكتوره دعاء سعد.
Carotid Canal.
This is the Carotid Canal. Excellent. نروح على هبه. اذا واحد راديوثيرابي يقول اني راديوثيرابي حتى نعبره.
نعم أستاذ، أنا راديوثيرابي.
اوكي. انسى عبيد.
نعم.
This is the Optic Canal. اوكي. نروح على رنين رفعت.
نعم أستاذ.
رقم 9.
Superior Orbital Fissure.
Superior Orbital Fissure. بعد ايش قد عندك محمد؟
تقريبا ثلاث ليبلات.
استاذ محمد كمل عيني استاذ محمد. استاذ محمد ويانا؟
اي وياك.
يلا كمل.
يلا لارا نصير.
laser wing of sphenoid.
زين 15 شيماء على
Foramen rotundum.
روتندا. زين.
This is the last table.
اي رقم 1 زيد يوسف.
نعم أستاذ. هذا internal auditory canal. internal auditory canal.